a lot of women will have pain with their periods. I mean, it's normal for the uterus to cramp during periods. Where I start to distinguish between that normal amount of cramping and pain associated with endometriosis is when it really starts to affect quality of life. When people are staying home from work, or they're having to take a lot of over-the-counter medicine. And sometimes I even ask people, are they taking it around the clock? And if they tell me that they're taking medicines preemptively, or they know that they're scheduling certain things around their periods, I really try to focus in on that, because then to me that says this might be something more. Additionally, if it's starting to get worse, like if it has a progressive timeline to it, then that's another thing that I think about when trying to distinguish pain related to endometriosis versus normal pains with a period. If you know you have a family history, it would be really good to have a good relationship with an OBGYN. You know, seeing an OBGYN on a yearly basis just to touch base and make sure that you're not having any early signs or early symptoms associated with endometriosis that could be addressed and prevent things from getting worse. Endometriosis, for most women who have it, means that it's going to be something that they live with for at least 10 to 20 years of their life. A lot of women will get diagnosed in their late 20s, oftentimes after dealing with pain symptoms for several years. And it's an estrogen-dependent condition that essentially will stay around as long as estrogen levels are normal in the reproductive years of a woman's lifespan. So from ages 18 to 45, I would expect it to potentially be some part for those years. Next steps for any person with endometriosis is, how much is it impacting your life? If it's a severe impact, then see a specialist. Talk about your options in management. If it's a minimal impact, then what can be done to prevent the complications that can occur later in life? We can't prevent endometriosis, but we can address it early. And by addressing it early, we can we can lessen the subsequent issues that it can bring about, like infertility and pain.